Welcome back, listeners, to Mosaic's Community Life Podcast, Life in Canada, Episode 20. Thank you for taking the time to listen to our podcast today. My name is Jane Teasdale, and I'm one of the co-owners of Mosaic Home Care and Community Resource Center. Our organization focuses on person-centered care, community, and social connection. Today, I would like to welcome Claudia Ehamparam from Get Right Physio, in-home physiotherapy, mobile physio. She is joining us today to tell us a little bit about her company. And before we begin, I will give you a brief bio about Claudia Ehamparam, who is a registered physiotherapist and owner. Claudia has 13 years' experience treating patients in-home and in the clinic setting. She prides herself on being an evidence-based and empathic clinician who builds rapport and trust with her clients. Claudia is also an assistant clinical professor, adjunct with McMaster University, involved in admissions, examining, and teaching. She obtained her master's degree in physiotherapy from McMaster University after completing an honors bachelor's of science degree in the co-op kinesiology program from the University of Waterloo. Outside of her work, she's a busy lady. She's enjoying traveling, working out, and spending time with her family, friends, and toddler and twins. My goodness, you've got a busy life, Claudia. So welcome to Mosaic's podcast.
Thank you so much, Jane, for inviting me on to your podcast and for having me today.
I would like to start off the interview for you to give a synopsis of your company, how long you have been in business, and the experience you bring within your organization for the community.
Sure. So Get Right Physio offers mobile, in-home physiotherapy, registered massage therapy, and kinesiology services. And we have been in operation for 2 years. Prior to that, I was working for 12 years at a clinic that also did home care. So I have 13 and a half years of experience as a registered physiotherapist, providing care to patients in clinic and in home now primarily. My specializations are in acupuncture, pelvic floor physiotherapy, and neurodevelopmental treatment, which is for anyone who might have suffered a neurological insult to their brain, so perhaps a stroke or Parkinson's disease. We use specific tactile cueing to provide treatment to their muscles to get them to engage better. And also, as you said, part-time, I teach at the University McMaster. And the reason for that is because I like to stay up to date with the evidence-based practice so that we can apply it here at Get Right Physio to all of our clients.
That's amazing. I think that's really important that you're sort of in that setting. So anything new that's coming out, you're gathering that information and then, as you said, using it within your organization. So, Claudia, I understand from our previous conversations last week that actually you provide additional services in hospitals as well for patients requiring more physio. Can you let us know a little bit about that?
Yeah, thanks for asking. So we do provide care in your typical home setting, a condo, apartment, as well as long-term care and retirement homes. But we also provide care in the hospital setting, which sort of developed as it came to be because of a need that was coming to our attention. A lot more families were calling in and saying, my family member is in the hospital, and they wanted to supplement the care that they receive there or the lack thereof. And again, that is not to point any fingers, but it's just, as you know, Jane, the caseload demand on hospital workers, physios, nurses is a lot. And so these families were telling me that their family member would get maybe 15 minutes of physio and maybe not even every day when they're there recovering from an acute injury or in a rehab setting. Most recently on the weekend, actually, Jane, since we spoke, somebody called me and their family member's in a rehab setting and she received 15 minutes. And that was actually really surprising to me because my understanding was it was daily physio for an hour in a rehab setting. So we go in there and we provide services there. as well. And I'd say our age range that we treat is all ages. We have treated pediatrics and children, but the majority of our age group is adults and seniors.
Oh, that's very interesting. And, I mean, the healthcare professionals within hospitals are really pushed to the max. And, there's so many people that are going in through emerge and falls and all sorts of things, So it is good that you can collaborate with them. And how do you work with the staff? So let's say you do have a client or a patient in the hospital. How do you then work with the other health professionals or rehab or social worker or whoever?
Yeah, thanks for asking. So, once we are contacted for services in the hospital, we either go through the family member, or we're happy to also collaborate directly with the hospital, whether that be the charge nurse or the lead physio on the floor that the family member is staying on, because we want to keep the continuity of care and the lines of communication open so that we can both work on the same goals for the client. So we have successfully been able to navigate the paperwork that's required to go in as an external healthcare provider. I can sort of do it with my eyes closed. I know what they'll ask for,
Yes.
and we're ready to present that information so that we can get in as quick as possible to help meet that need and fill that gap.
And you're absolutely right. I mean, the same, not that Mosaic is the same with you providing physio, but that's the other thing is that when families are going in, they might need additional care coming in. So with Mosaic, we're providing additional care to take the stress off the staff by providing one-on-one care within the hospital at bedside sitting. I did want to just bring this up on some of the research that I've sort of reviewed on certain websites, and there is a number of research papers and abstracts from researchers that discuss and highlight the decline of patients being in hospital or specifically in long-term care that may not have the physio. Hospitalized patients spend between 87 and 100% of their time lying in bed or
Wow.
sitting, and this would be the same in long-term care similarly. Irrespective of the reason for admission, low levels of physical activity have been associated with negative health outcomes, like functional decline, increased length of stay, increased risk of institutionalization. So research shows that they are aimed at increasing the physical activity levels of hospitalized patients are really of great importance. So really you're helping with that within the community to get those individuals up and walking and then hopefully discharge.
Yeah, thanks for sharing that. Like if I could add on there, the effect of sarcopenia. So sarcopenia is age-related natural muscle loss that we all experience. And it rapidly increases after the age of 50, and quite quickly after that with every passing decade. So like you said, if someone's in hospital, if you don't use it, you lose
Lose
it.
it.
And I think people see that in their quick decline of muscle strength. So it is recommended that we exercise with resistance. So either weights or TheraBands, body weight, at least 2 days a week in order to maintain our muscle mass, Jane. And if we want to increase our muscle mass, we need to do that 3 times a week. So you can see how quickly this can happen and how important it is for us to target that, which is my hope, with podcasts like this, that there will be more education around this topic of, hey, physiotherapy doesn't have to be rehabilitating an injury that's already happened. It can be preventative,
Yes.
by having people seek our services before it's too late for their family member, before they go to hospital. Why not have somebody come in and see them and do these exercises with them to keep their strength up? And also, like you said, help their mental health and well-being, because we know that the effect of exercise doesn't only impact physical outcomes, but it affects mental outcomes. People who exercise in the research have been shown to have greater attention, greater cognitive ability, less depression because of increased mood boosting hormones like serotonin
Yes.
and decrease in stress hormones like cortisol.
So I think what you're saying is people need to be proactive rather than reactive. I'll just give a little, I've come back from Bordeaux, and
Yeah.
I don't know if I was in shape when I went, but there was a lot of walking involved, and there were about 75 to 80 steps that we had to get up to the apartment. So when we first we first went there, I looked up at all those steps, and I think I made the two levels, and then I was like, because I was sort of out of shape and sitting at the computer and not walking and building up my strength, I wasn't able to get to the third level. So as time went on, like at the third week, I was able to get up those stairs quickly. So that's it. And now back at home and back working in the office. So I really have to keep that fitness up, as you say. I will lose it if I
I
don't
was
use it.
Yeah, I was gonna say, hey, maybe I should come and do some services
Yeah,
with you.
I think
Keep
so. I think I might need it. So, I mean, it'll help me as you say, as you age. It's really important to exercise. And as you know, I mean, our listeners, that Mosaic provides person-centered care, and we really deal with the person at the center of care. So, Claudia, I know you go into many homes, including retirement and long-term care and hospital. How does your organization provide person-centered care, and to make the client feel at ease?
Yeah, I think it's one thing to go in with your clinical hat and do your assessment and then say, these are my findings and these are my recommendations for you. But it's another thing to really use active listening skills. And I think that's at the center of patient-centered care, Jane. So active listening skills, demonstrating empathy by having good bedside manner and really asking the patient first and foremost, most importantly, what are your goals? So even
Mm.
when a family member calls me for our services, obviously the first question is usually how much does it cost?
Yes.
And my first question to them is, what is your goal for your family member? Or what is your goal? What can we help you achieve through physiotherapy? Because that needs to be at the front and center rather than me being clouded with what I might observe in my assessment and then recommend that they do X, Y, and Z. So I think that's how we do that. And just to give you a quick story, I was in someone's home a couple of weeks ago, and she was discharged home, but she's in a hospital bed, and her goal was to get out of her hospital bed into a wheelchair to be able to move around her home. But given her circumstances, a long hospitalization, a recent loss of her spouse, lots of change the seniors are dealing with. It's a lot to cope with. When you go in to see her, she's really in a very sad and down mood. And she often will turn away our providers or completely decline participating. So that day that I went in, I just listened to her for 40 minutes, and there were a lot of pauses when she would say something. I wouldn't immediately rush to
Mm.
say something that I wanted to say. Trust me, I wanted to, but I listened. And by the end, like about 40 minutes into our session, she turned. I got her to turn, and she said, you know what? When I asked her one thing, I said, I knelt down beside her bed and I said, can I just ask you one thing? Today you said you want to remain in this bed until the end. Is that true? And she said, of course that's not true. I want to get up out of my bed. And I said, okay, I just want to make sure that our goals are aligned. And I'm here as a physio to get you moving. If you want to do that, I want to help you. And we were able to do some physio for the remainder of the session together. And it was a small step in the right direction. So I think that's the key in answering this
Yeah.
question for
And I
you.
think you're right. I mean, I think it's about client driven listening, health professionals listening to the client speak and their concerns or what their goals are or what they want to achieve. And, again, listening is really important when you're dealing with older persons as well. And I guess, they make their own time and what they want to do. And
Yes.
they'll let you know. Just going back to the discharge from hospital when you're dealing with a client being discharged and the family has reached out to you. So how does that work? What is the process when you're dealing with that, and then you're going to be providing physio in the home?
Mm-hmm. Um, So families have become quite proactive. I'm getting emails or calls from people when their family member is still in the hospital or there's talk of a discharge date that's coming. So that's really nice from our end because then we can plan accordingly to make sure that their family member is supported immediately once they get home. But essentially, they call us, and what we will do is we'll ask for a discharge summary from the hospital if that's available. Or we will look at the physiotherapy treatment plan that was given to them, the exercises, and use that if it's still appropriate for the client, or build on that and progress. So it's still, again, that continuity of care. And just having those conversations again. What is your goal? And maybe we find that there's a need for a referral to another organization, maybe like yours, or someone who could support their mental health, like a social worker. And so we make sure to do that and see the person kind of holistically. Did I answer your question?
Yes, yes, you
Okay.
did. And definitely that's the way that Mosaic works as, not only just providing home care, but, through the ethos of our organization on the community and being able to help families. We can't do it all. Not one organization can do it all. So you're having to surround yourself, organizations with very well respected individuals that can provide that care or additional services that might be needed by the family.
Yeah, and I just wanted to say on that note of hospital discharge, just because it's been such a topic here of today, we do try our best, like I said, to collaborate with the hospital and provide the services that are needed for the family that we're helping. And I would encourage your listeners, our viewers, to check out our Google reviews because there have been a couple of people who have written about their experience with us working with the hospital and working with their family member while in hospital. And I have to share this one story. We helped somebody who was in hospital for 15 months. They called us, and within 8 weeks, we got them discharged from the hospital, one of the hospitals here in Toronto, to a rehab facility so that they could have daily physio, and they no longer needed our
Yeah,
services. And that's a win, right? Like I always
that
say to
is a
people
win.
in the nicest way, I don't want to see you.
Yeah,
That means that I'm doing my job. So things like that are really important, I think, to remember and celebrate as why I do what I do.
yeah. And certainly it's helping people and people are seeing their goals met and they're up and walking or feeling stronger, so your services are definitely helping people. uh, through our organization, we're seeing, there is a lot of admissions into ER on falls risk. So how does your organization deals with those at risk of falls?
So, one of the things that I've recently been offering are evidence-based presentations to senior homes, senior groups, on falls prevention and balance and exercises. So, again, educating on, what would that look like if you were to work with our team? And the other thing that we do is in a lot of our clients, like you said, there is a falls risk. So we assess that risk through using standardized performance-based outcome measures that are supported in the medical literature. So, for example, the Berg Balance Scale, and we administer those tests at the baseline, and then we re-administer them about 6 to 8 weeks later, ongoing to measure change and to see the effect of our treatment plan as well. And something that I'm looking to do in the future is hopefully more education and teaching of the skill of getting up from a fall, because we always talk about falls prevention, but what about what happens after?
And educating people, if there's a family member there, how to safely move that person if they had a fall. And just on the point of you doing presentations, perhaps we need to have you at Mosaic in the fall to come
I'd
and do
love
some of those
to.
presentations, because I think a lot of our community members are they're wanting to get that information, and so it would definitely be helpful for them.
Sure.
And Claudia, can you explain, just a little bit? People are receiving some support for physio through home and community care support services, and so how can you provide a top up for clients needing additional physio?
Yeah. From my understanding and speaking to these clients, they do report that the services they're receiving from home and community care can be a little limited, whether that's in the duration of each session or the number of sessions. So they like to have additional care, and we're happy to supplement that. So if they don't want to either wait, there usually is kind of a wait upon discharge before they receive their first visit. We can go in and supplement at that time, or we can supplement after their visits have ended with the public system, or in addition while they're having it, and provide care that way so that they're getting, our sessions are 60-minute visits in home. They're comprehensive. We do not only exercises, which is the most supported thing in the literature, but we do manual therapy. We bring a treatment table. If they're able to get up on a table, we put our hands on them. We provide acupuncture services. So it's very comprehensive.
That's amazing. The service you provide very helpful for the community. And how long does it take to set up services with your organization?
Not very long. I always tell people we work as quickly as you can work. So our process is you contact us, we send you an email, which is an intake form that takes 2 minutes to fill out. Very quick. I'd rather not deter people from having a long form to fill out, but on that form, it asks them, what are your goals? Have you had physio before? Obviously, where do you live? And your availability. And we go through our confidentiality consent, and we take credit card information through our secure encrypted medical record system that we use. And then we can book you in, I'd say within 24 to 72
That's
hours.
really good. That's really fast. And also, upon discharge from hospital, they can let you know anytime, and that can go quite quickly.
Yeah.
So, sometimes families are scurrying around, needing to find additional care coming in or services. So that's pretty amazing as well. And how would somebody get a hold of you, Claudia, if they're interested in physiotherapy sessions?
So they can call us at 647-370-5162. They can also text that number. They can contact us via email, hello@getrightphysio.com. Our website is www.getrightphysio.com. And on Instagram, we can be found at Get Right Physio.
So you've given all the social media and information to make it easy for people to contact you if they need your services. I also understand that you have a newsletter. And again, how would somebody find out about this to be added to the list so they receive your emails?
Yeah, we have a monthly newsletter, so it's not a lot of spam to your inbox, just once a month. You can sign up for our newsletter on our website. And on that, I always write a blog article which touches on some of the things we talked about today. So, how long does it take me to recover? Why do I need in-home physio? What are the benefits for a senior trying to maintain their independence in their home or after recovering from a surgery? And what is the mental health benefits in terms of physio? So those are some of the topics that I've written about. So it's not just a newsletter where I'm sharing a little tidbit about my personal life, but it's also some really good information for people to learn and be educated on.
Yeah, I think newsletters work out well. Mosaic does send one out. So hopefully, when you come, looking at having you come in the fall, we can also add one of your blogs into our newsletter. So that would be
Sure.
helpful.
Yeah.
And definitely, Claudia, I would like to thank you for spending time with me and our listeners on Mosaic's Community Life podcast, Life in Canada. And at this time, I usually ask our guests if they want to leave a takeaway message. So, do you have a takeaway message for our listeners?
Yes, I read a quote a couple of months ago that said, "A doctor saves lives, a physiotherapist makes that life worth living." And it was really sort of cute and resonated with me. And in thinking about that, as we mentioned before, a natural part of the aging process is muscle loss. We said it rapidly declines with every passing decade after the age of 50. So, given this information, why not be proactive rather than reactive by investing in your health with physiotherapy? Your future self will thank you.
So thank you, Claudia. It's been a pleasure having you on our podcast today. Until our next Mosaics Life podcast, this is Jane Teasdale signing off.